Bruce Willis's frontotemporal dementia is more common than you think, and understanding it could change the way we look at brain health. Did you know frontotemporal dementia, FTD, accounts for up to 20% of dementia cases in people under the age of 65? Despite its prevalence, FTD is often overshadowed by other forms of dementia like Alzheimer's. Today we'll take a closer look at this often misunderstood condition and what Bruce Willis's diagnosis means for millions of others. By the end of this video, you'll have a better understanding of how FTD affects not only memory, but also behavior, communication, and quality of life. When Bruce Willis's family publicly shared his diagnosis of frontotemporal dementia, it brought widespread attention to a condition many people weren't familiar with. But why should we all care about this? FTD is a progressive neurodegenerative disease that specifically targets the brain's frontal and temporal lobes, areas responsible for managing our personality, decision-making, emotions, and language. Unlike more well-known dementias like Alzheimer's, FTD can affect people at a much younger age, often in their 40s or 50s. Because of this, it's frequently misdiagnosed, sometimes as a psychiatric disorder or even stress. In this video, we'll discuss Bruce Willis's journey with frontotemporal dementia, the symptoms and causes of this devastating illness, and why it's crucial for us to better understand brain health. Bruce Willis's diagnosis has opened the door for more people to learn about FTD, but many are still unaware of its significant impact. Frontotemporal dementia is much more than a memory disorder. It's a condition that affects almost every aspect of a person's life: communication, social interactions, and the ability to function independently. For someone like Bruce Willis, who built a career on sharp dialogue and strong emotional presence, this diagnosis can be particularly hard to bear. FTD affects how people relate to the world around them. The emotional and behavioral changes are often the hardest to cope with for both patients and their families. Those diagnosed with FTD may lose the ability to control their emotions or even express empathy. For families, the experience of seeing a loved one change so drastically, losing the essence of who they once were, can be heartbreaking. Bruce Willis's diagnosis highlights these struggles and gives us a window into the reality of living with this type of dementia. So, what exactly are the symptoms of frontotemporal dementia? And how does it differ from other dementias? In most dementia cases, people often associate memory loss as the primary symptom. But with FTD, the earliest signs can be more subtle and harder to recognize. It begins with changes in personality, mood, and behavior. In some cases, the person may become socially inappropriate or lose the ability to empathize with others. These changes are due to the deterioration of the brain's frontal and temporal lobes, which regulate emotions and communication. Some common symptoms include impulsive or reckless behavior, loss of social inhibitions, compulsive actions, and difficulty in understanding or producing speech. In Bruce Willis's case, his family initially shared that he had aphasia, a condition that affects a person's ability to communicate. Aphasia often appears early in people with FTD, making it difficult to find the right words or follow conversations. Unlike Alzheimer's, which is mainly a disease of aging, FTD often strikes earlier. It can be difficult to diagnose because it mimics other mental health conditions, and because people often don't expect dementia to appear in middle age. The exact causes of frontotemporal dementia are still being researched, but scientists believe that a combination of genetic and environmental factors plays a role. Around 40% of FTD cases are linked to inherited genetic mutations, which means that if a close relative has been diagnosed with the condition, there's a higher risk of it appearing in other family members. However, many cases develop without any known family history. Despite ongoing research, FTD remains one of the most challenging dementias to treat. There are currently no cures or disease-modifying treatments available, though there are therapies that can help manage symptoms. The lack of effective treatments highlights the need for greater awareness and funding for research into this disease. Bruce Willis's diagnosis brought frontotemporal dementia to the forefront of public attention. For many, it was the first time they had heard of the condition. His family's public announcement sparked a much-needed conversation about brain health and the realities of living with dementia. While Bruce's acting career may have come to an end, his battle with FTD has inspired others to open up about their experiences. It's brought a new level of awareness to the challenges that millions of families face worldwide. The more we talk about it, the more we can advocate for better research, better treatments, and better support for those affected. Frontotemporal dementia is a devastating and often misunderstood condition that affects people in their most productive years of life. It can change not only how a person interacts with the world, but also who they are. For Bruce Willis, it's a battle that has impacted both his personal and professional life. His diagnosis has raised awareness, but we still have a long way to go. By understanding FTD and the toll it takes on individuals and families, we can push for greater research, early detection, and better treatment options. If there's one thing to take away from this, it's that brain health is something we should all pay attention to, and supporting those affected by dementia is crucial. What do you think about Bruce Willis's journey and the challenges of frontotemporal dementia? Let me know in the comments. Your thoughts and stories could help others going through similar experiences. And if you'd like to learn more about dementia and brain health, make sure to check out this video on understanding Alzheimer's and what steps we can take to maintain our cognitive health. Don't forget to like, subscribe, and hit that notification bell for more health awareness content.